Welcome back to The New Health, and back with us today is Dr. Cheng Ruan from the Texas Center for Lifestyle Medicine. Thank you so much for coming back again with us.
Thanks, I'm having a ball. Love to come back here.
This is so much fun. I love all of your passion for the work that you do.
Thank you so much.
I would love to talk a bit about neurodegenerative diseases. First, if you could tell us what those are.
Yeah, absolutely. Neuro means nerves. It could be the brain, the spinal cord, or other nerves as well. Degenerative is not generating, means that things are going downhill, right? So the brain could be shrinking, the nerves could be damaged, et cetera, et cetera. So neurodegenerative is a classification of a lot of different disease states. Parkinson's, Alzheimer's, Lou Gehrig's disease, multiple sclerosis. And I also classify a lot of mental health disorders into neurodegenerative diseases as well, such as ADD, ADHD, et cetera, et cetera.
Oh, that's very interesting that the ADD, ADHD are in that space. Can you tell us a little bit about why you put them together?
Sure. If we look at the brain, we know that the brain shrinks after a certain amount of aging. Yeah? So my sister's an interventional radiology resident at NYU, so we kind of talk about the brain is that when you look at the brain, the radiologist will say age-related changes. So we kind of expect the brain to age and shrink a little bit, right? But the American Academy of Pediatrics shockingly have released bulletins and guidelines saying that children at 5 years old are starting to have their brains shrunk if they have more than 2 hours of screen time, especially more than 3 hours of screen time per day, okay? Wow. Which leads to ADD, ADHD, et cetera, et cetera. So we can't really see mental health as separate from brain health. So I would say most mental health diagnoses could be a component of a neurodegenerative disease. But a lot of times we don't look hard enough.
Okay, so first and foremost, for those parents at home, and they're thinking, my young child's brain is shrinking, is there something we can do?
Oh my gosh, there's actually so much you can do. So one of my favorite books is written by a really good friend of mine, Dr. Daniel Amen, How to Raise Mentally Strong Kids. Like, it's really actionable wisdom in that book. But limiting screen time is really important. But parents, listen, I have a 2-year-old, 8-year-old, and 10-year-old. They have iPads. I get it. You're like limiting screen time and then your eyes glaze over. What happens is most people will limit the screen time, but they don't replace that with anything else. You have to replace screen time with something that bonds you, that connects you. Eating at a dinner table, playing hide and seek. That's what I did last night with my 2-year-old, right? Battleship, my family loves Battleship. My wife hates Monopoly because she never wins, but I love Monopoly. Uno, right? Going out for a swim, et cetera, et cetera. And so the screen time is almost like the easy button to keep a child occupied, so it's sort of like the don't bother me while I grind, do work, et cetera, et cetera. Now, I'm in a household where both me and my wife are physicians. My wife is an OBGYN, so we're busy, right? And so, but we have to make time to connect. Interestingly enough, when you do that, the ADD, the ADHD, those symptoms start improving and start going away. But guess what? So does dementia. As we find out that what is the number one risk factor for the elderly losing their memory quicker is loneliness and isolation. And we've seen over and over again that when we get the family surrounding the elderly as a unit and raise this person up, guess what? They're more interactive, they're less depressed, and we see it in all humans, right? So it's not just kids, and it's not just the elderly. And this is the most powerful thing about neurodegenerative disease, is that this is a community healing structure that we have to set in place. And that's actually what we do at Texas Center for Lifestyle Medicine.
I love this. And my mom, this makes me think of my mom. She's 76. Sorry, Mom, I'm outing you on TV. But she is sharp as a tack. Social groups. If we want to spend time with her, we need to get on her schedule.
Beautiful.
That's just who she is. And she is absolutely healthy and well and mobile and vibrant and beautiful. So this is really resonating with me. So this is sounding like, yeah, as you said, probably some of what you do at your work, with your work.
Yeah, absolutely. And another big thing people don't understand about neurodegenerative diseases is that we have to look at it from the outside in approach. Well, what does that mean, outside in, right? So people think, oh, your brain must be shrinking and there must be some supplements or diet and things that you can take, right? Well, no, that's although that's important, it's not as important as what is your posture doing? Are you slunched over, right? Do you have a lot of chronic pain? What happens is that your posture determines your whole health, your blood flow to your organs, detoxification through the liver, through the brain zone detox system called the lymphatic system, right? It determines how much cerebral spinal fluid bathes the spinal cord as well as the brain, which also supplies the brain with nutrients and detoxification at the same time. It also controls hormones, right? And so what we're seeing is that the posture is everything, okay? So when someone comes in and their posture is not great, and then all of a sudden they're handing me papers with a neurologist and labs and stuff like that, I'm like, hold on a second, I want you to stand up for a second. I'm going to look at you walk from the door to here. If you're a patient listening to me, you're probably laughing because I do this for every patient. Let me look at your posture first, right? So outside in means how does someone physically look? If they're limping, if their hips are tilted, like this is where like physical therapy, chiropractic, my mom's an acupuncturist, acupuncture can come in, because this is actually required for the body to balance that Zen balance, if you will. And when the posture improves, just like when you get a massage or a chiropractic adjustment, afterwards you're like, oh, I feel really good, right? And you're releasing these neurochemicals from the brain, and these neurochemicals can actually stimulate regeneration. The most important neurochemical is BDNF, brain-derived neurotrophic factor, which is like miracle grow for the brain. I heard it called once, right? And these get released whenever there's movement, there's exercise, there's alignment, right? And so, but that's true whether you're a kid with ADHD or an adult with mild cognitive impairment or early Alzheimer's disease. It's the same, right? Or if you have multiple sclerosis, and et cetera, et cetera. And so, like, these are the things that are kind of tying everything together when it comes to all neurodegenerative diseases.
So I'm going to just briefly touch on BDNF. I have so brain-derived neurotrophic factor.
Yeah.
From my understanding, and please correct me, that 20 minutes of movement a day can help with your BDNF. Is this correct?
Oh yeah, absolutely. It's dramatic too.
Tell us a little bit about how is that so?
Well, movement can literally just be walking, or there's a lot of people who are disabled who have wheelchairs at home, like start working with the wheelchairs, start working with occupational therapists and physical therapists, right? And so what's happening is that as you're physically moving, your connective tissue called the fascia is starting to kind of relax a little bit. And the fascia's job is to protect you, kind of like wrap you in a blanket, right? The problem is the fascia has 250 million nerve endings in there, and when it wraps you too tight, it will hurt, right? And so this is why when you're laying around the couch for such a long time, you get up like, oh my God, my back hurts, right? Well, that's only because you've been laying around the couch for so long.
Yeah.
It may not have anything to do with your actual back in terms of the bony structures or the disc or anything like that, right? And so when you get up and actually move, you're relieving that. But what's happening is that you're breathing. Your lungs can deploy, your diaphragm can deploy down. Above the diaphragm is your lungs. You're actually drawing air to the bottom part of your lungs. You're oxygenating a whole lot better as well. And we're aerobic creatures, which means that we need oxygen to actually survive and thrive. And that's not, our brain's not any different. Our nerves aren't any different. It's the same structures that are there. And the other thing about that is that you're actually moving and contracting your muscles. So it induces your body to go into metabolism. You're using up sugars, you're using up nutrients that are there, right? And so because of that, your body is trained to be in safety mode and sort of relaxation mode. So a lot of people have this thing called the post-workout high, where after you work out, you feel really good. Like that's what's actually happening. There's different neurochemicals, there's oxytocin, there's dopamine, and all sorts of different things that are kind of presented out there. You're like, okay, I feel pretty good, right? But that's what's going on when we talk about 20 minutes of movement.
So you mentioned that now we're talking about movement, we're talking about breathing. You've mentioned, making sure we're breathing because we're shallow breathers a lot of the time, so we don't remember how to have deep breath. All of this seems so fitting for exactly the lifestyle idea, for lifestyle medicine.
Yes. And we have to honor that first, because if you think you can just not move and take supplements, you can't out-supplement like inactivity. That's not a thing. It's not possible. Or the other huge part of neurodegenerative diseases is sleep apnea. Sleep apnea is rampant right now. In fact, it's getting worse generation after generations. Our skull formation is changing quite a bit. So if you're diagnosed with dementia, neurodegenerative diseases, ADHD, and either you haven't had a sleep study or you have had a sleep study and you have sleep apnea and you're not being treated, well, it doesn't matter what supplement you take. Exercise, it may help a little bit. It doesn't really matter what diet you have. Like your apnea means lack of air, apnea, not breathing. Your apneas are creating the most root element of neurodegeneration as well. That's got to be treated. It's without a doubt the most important thing that's got to be treated. And it's the number one missed thing in all doctors when they see patients with neurodegenerative disorders. And guess what? Sleep apnea happens in thin people, it happens in women, and it happens in my 3 daughters who are 2, 8, and 10, okay? And so we have to really reclassify what's really going on when your brain's degenerating. It's really a lack of sleep. Part of it may be sleep apnea. If you're having grinding, you have TMJ issues, chances are you probably have sleep apnea. You don't even have to snore to have sleep apnea. In fact, most people who have sleep apnea don't snore. I don't know if you know that. And so this is something that's really, really commonly missed when it comes to neurodegenerative diseases.
So you've heard it right here, right from Dr. Ruan. We need to be making sure if you're concerned about the possibility for sleep apnea, please get checked. So thank you so much again for being with us.
Thank you.
So will you please let everyone know what you're working on right now and how people can find you?
Yeah, so interestingly enough, we're talking about sleep and neurodegenerative disorders. We're working on a couple conferences that are educating healthcare professionals to do that. So if you're a healthcare professional, go to Physician Transformation Institute, which is my website for healthcare professionals. If you're a patient, go to texascenterforlifestylemedicine.org. That's so you can find us as a patient. And we will collaborate with pretty much everyone in the greater Houston area and all over Texas as well. And then find me on LinkedIn, and find me on Instagram as well. Just search my name, Cheng Ruan, MD.
Thank you so much for being with us again.
Thank you.
So join us again next week when Dr. Ruan will be back. Thank you so much for joining us for The New Health, and we'll see you next week.
Cool.
This has been a Now Media Networks feature presentation. All rights reserved.